Hello friends, today we are going to talk about a very interesting topic known as Parkinson's disease. Now Parkinson's disease is a specific central nervous system disorder which basically affects due to the disturbance or problem in the basal ganglia of the brain. Now what happens in this disease is that there is a neurotransmitter known as the dopamine which actually relates or communicates between the different neuron or nerve cells of the brain. When this dopamine level goes down, this affects the communication between the different neuron cells, and that in turn affects the motor functions of the body, because those functions are controlled by the basal ganglia of the brain, and when that communication is broken down or it gets decreased, it affects the motor functions in the body. अब मोटर फंक्शंस जो हैं इसके क्या सिम्टम्स होते हैं? देयर आर वेरियस सिम्टम्स दैट आर सीन इन पार्किंसंस डिजीज़. Now in the first, that is the most important and easily visible symptom is the tremors of the hands or feet. जब भी पेशेंट रेस्ट पे रहता है उसके हैंड्स में ट्रेमर स्टार्ट हो जाता है. This tremor can start either immediately or it can gradually develop over the period of time. Second symptom that occurs is that the patient's movements, they get slowed down. This is in medical terms known as bradykinesia. In this what happens is that the muscles, they are not affected as such. Muscles में कोई problem नहीं रहता, like उनकी strength में कोई problem नहीं होता, but जो communication from the brain to the muscles होता है वो slow down हो जाता है due to the low dopamine levels, और उस करके जो muscle control है body का, different functions जिससे controlled रहते हैं उसमें affect आने शुरू हो जाते हैं. तो सेकेंड जो ये सिम्टम है ब्रेडिकाइनेसिया, दैट इज़ ऑल्सो एन इम्पॉर्टेंट सिम्टम सीन इन पार्किंसंस. Next symptom that is seen usually is the rigidity or stiffness of the muscles or body parts. Now these stiffness and rigidity can be known as lead pipe rigidity or cogwheel rigidity. Now the lead pipe rigidity एक तरह की constant unchanging stiffness रहती है जब कोई भी body part move होता है या कोई body movement होती है, जबकि जो cogwheel stiffness होती है उसके अंदर tremors के साथ साथ rigidity या lead pipe rigidity दोनों इकट्ठे मिलते हैं. इसमें पेशेंट जब वॉक करता है तो उसकी जो मूवमेंट रहती है वो बहुत स्लो और रोबोटिक टाइप मूवमेंट रहती है, रिजिडिटी रहती है मसल्स में और जर्की मूवमेंट्स रहती है, और जब पेशेंट मूव करता है उसको काफ़ी अनस्टेबिलिटी रहती है ड्यूरिंग वॉकिंग. तो ये इसका नेक्स्ट सिम्टम होता है, दैट इज़ द वॉकिंग गाइड और एन अनस्टेबल पोस्चर. जब अनस्टेबल पोस्चर होता है द पेशेंट में आइदर बेंड फॉरवर्ड और दे में बेंड मूव डाउनवर्ड और हंच डाउन, एंड ये तब विजिबल होता है जब पेशेंट वॉक कर रहा होता है, बिकॉज वो छोटे छोटे मूवमेंट्स या शॉर्टर शफलिंग स्ट्राइड्स लेता है और उनकी आर्म्स कम मूव करती हैं. तो जब ये मूवमेंट कम होती है दे मे टेक सेवरल स्टेप्स, बट वाइल वॉकिंग इवन दे हैव टू टेक लाइक सेवरल स्टेप्स ड्यूरिंग वॉकिंग. Next symptom that is seen is that the blinking of the eye movements, which is another motor function, is also decreased. So they don't blink as often as a normal person. Next is the cramped or small handwriting, which is known as micrographia. इसके अंदर पेशेंट जो कुछ भी लिखता है तो वो बहुत स्मॉल या क्रैम्प्ड लेटर्स में लिखता है, उसको ईज़िली यू आर नॉट एबल टू अंडरस्टैंड इट, और इट इज़ वेरी स्मॉल, और दैट इज़ वाई इट इज़ नोन एज माइक्रोग्राफिया. Next symptom that is seen is the drooling of the saliva from the mouth, which occurs due to loss of the facial muscle control. Due to this also the facial muscles get affected, so the appearance of the face is just like a mask. Other symptoms that are seen is like trouble swallowing, which is known in medical terms as dysphagia. Now ये कब होता है? ये due to the muscle control that is lost in the throat muscles. So further in advanced cases it may lead to choking also, or may lead to pneumonia. And another symptom that is seen is that the voice gets affected, so the patient speaks in a very soft voice, which is also known as hypophonia. This occurs because there is decrease in the muscle control in the throat and the larynx. Now, besides these motor functions that are affected during Parkinson's, there are some other symptoms that are the non-motor symptoms that are observable in a patient with Parkinson's. इनके अंदर जो symptoms देखे जाते हैं, these are the hypostatic hypotension, which is basically कि जब patient खड़ा होता है, their pressure tends to drop down as compared to their sitting position. And if you compare both of these readings, it is often seen that this hypostatic hypotension is frequently observed in these patients. Next symptom that is seen is the urinary incontinence. They have difficulty in voiding urine, or it's very slowed down. Then patient may have GIT problems or constipation. Some patients may also develop sexual dysfunctions or loss of smell, this which is also in medical terms known as anosmia. In some patients, they may develop sleep problems or restless leg syndrome. They may have trouble thinking or focusing on anything particular, or they may develop depression. So these were some of the motor and non-motor symptoms that are observed in case of a Parkinson's patient. Also, this disease is actually staged or classified according to the different stages of development into various different stages like stage 1, 2, 3 and so forth. Now let's talk about some of the management that can be done with homeopathic medicines, and if this has recently started, in some cases it can even be prevented from further progression. Now, depending upon the symptomatic treatment of the patient, now since the brain cells are already damaged or there is low dopamine, so brain exercises are usually very helpful in this condition. If the patient is made to do some physiotherapy or some exercise that involves using their brain, like solving puzzles, or if they are that they start at an early age, or if they do something out of the regular routine that they are usually doing for so many years, like for example, if they are brushing their teeth with the right hand, let them try to do it with their left hand. So that will actually improve and regenerate their motor neurons or help in having a better interconnection between the motor neurons. Also, then there are some homeopathic medicines such as the medicine known as causticum, which is very good in case of rigidity of the single muscles, like if there is rigidity of the throat muscles and the patient is having difficulty in swallowing, then this is a very useful medicine. Besides this, we do have to look into the other symptoms of the patient, like what their desires and their aversions are to certain foods, how they feel better, what are their other problems that they are having, and if there is any history of grief or sorrow in their back which may have triggered this problem in the first place. Then there are some other symptoms such as the Califos or Ravolfia, which are useful for improving the nerve power of the body, and also they help in patients who have sleeplessness or restless leg syndrome. Then medicines such as zincum and zincum phos, or there are some other medicines like sarcolic acid, hyoscyamus, and many other medicines that can be useful in this condition depending upon what the patient is experiencing and how it is going on. Then sometimes the patient may also have symptoms like for the case of urinary incontinence, or if they have problem avoiding the urine. In those cases, medicines such as cantharis, if there is burning during urination, or if they have violent anger with that, in those cases some medicines may be beneficial. Then there are some other symptoms and medicines that can be given to the patient depending upon what symptoms they are experiencing due to this. And it is important, like with the medicines and the general management, the general management should also include physiotherapy, especially if they have tremors of the hands and they are not able to hold anything properly. Then it's important that they go to a physiotherapist or do some physiotherapy exercises at home itself. Or if they are not able to do that, then they may actually take the help of some other person. And sometimes if that's not possible, nowadays there are even some bionic gloves that are available, which are actually improves or decreases these tremors in the hand. Also, then there is important that they maintain a healthy and active lifestyle as much as they can. Like they can do some physical exercise, like simple walking for every day, changing their atmosphere, for example, then engaging themselves in other social activities or whatever interests them, like reading or inculcating some new hobbies. So whatever that can do as a form of exercise for the brain, that will actually help and prolong the condition from developing further. So these were some of the conditions and issue problems that occur that may be prevented if the condition is handled right from the very beginning. And then there are some very good nerve tonics such as Brahmi, Ashwagandha, and some other tonics like Ginkgo, which is a very good herb for a brain blood barrier, and that really improves the improvement in the blood flow to the brain, which can further help in some extent if this condition is taken with proper medicines and management. So I hope this was a short video on Parkinson's disease, and in case you enjoyed and liked, got some information about this disorder, please like and share with your friends and family so everybody can get some information about that. Thank you and have a great day.